Kerala floods now across Kerala. Local administrations, NGOs and citizens are working on the reconstruction of infrastructure and homes that were washed away by the recent floods. But one big crisis that the state is currently facing is the spread of disease. In fact, CNBC TV 18's Jude Sannith, who has travelled to Kerala's Wayanad district to take stock of the rebuilding efforts, reports on what the state government is doing to battle the crisis. Take a look.
For the last couple of weeks, thousands of locals and members of Wayanad's indigenous tribes have been making a beeline to health camps like this one. Over 15 have been set up in Wayanad alone since the flood waters began receding. Dr. Sumana Sharma, who works at one such camp in Wayanad's Padinjadara municipality, sees a minimum of 350 patients per day, 60% of them women. The most common complaint from these patients:
they have a lot of upper respiratory tract infections and then a lot of bacterial infections and post-flood skin infections. We've been encountering a lot of fungal infections which are mostly due to post-flood areas and mostly in post-flood areas.
The state government has also issued clear instructions that any cases of communicable diseases like tuberculosis be reported to the health department immediately. Bacterial diseases are a more recent occurrence and are being attributed to well water being contaminated by flood water. Just a week ago, 214 wells, much like this one across Manandavadi, were rendered dysfunctional on account of sewage water contamination. But now, after chlorination and desludging, they've been painted white, which is a sign that they can be used again. The district administration is taking no chances. It has drawn up plans to desludge, chlorinate and re-water all the wells in flood-affected wards in an effort to avoid a major health crisis.
Out of 36 wards, 32 wards have been flood affected. In these 32 wards, chlorination, superchlorination and desludging have been done. In addition to this, we've also desludged all public wells in these wards.
But there's no denying that this will all take time. And in the meanwhile, thousands of residents of Wayanad have already reported health concerns, and that number multiplies exponentially at a statewide level. In Wayanad, Jude Sannith.